Hi, this is Lynn Fitzgibbons here to talk to you about what's new with COVID this week. We're going to talk about the winter surge that's hitting California and unfortunately looks to be threatening our own community too. We're going to review what we know about the Omicron variant that we first heard about from South Africa and of course now found across the United States. We're going to talk about Omicron variant and how that relates to booster vaccines. And finally, we're going to finish off reviewing what we should all know about antigen testing at home. The case rates in Santa Barbara County are thankfully lower than they were in August and September, but unfortunately they have stopped declining. And what that means is in these last 2 or 3 weeks, not only have we plateaued at a relatively high case rate, but we are seeing just in the last 1 or 2 weeks, the case rates in Santa Barbara County rising again. As it looks to be across the state of California and indeed across the United States, we are concerned that this may be the first signal of a winter surge that will hit our community. The Omicron variant is getting a lot of attention, and rightfully so, as a new variant of concern first identified in South Africa in late November. We now know this variant is throughout the world, including here in California. And it's important to know about the Omicron variant, not because it is causing the majority of infections right now in our community, because we do not believe that that's the case. But we want to make sure everyone knows about the threat that the Omicron variant may pose in these weeks and months ahead. Compared to past variant, there are many changes, what we call mutations in this variant. Some of these changes are in the spike protein, and this is important because the spike protein is where our antibodies bind. This has raised concerns that our defenses from either vaccines or from prior infections may not protect against Omicron. And Omicron infections are unfortunately spreading very quickly in South Africa as well as around the world. We do suspect it is more infectious than prior variants and spreads more quickly. We call this a faster doubling time of infections. The Omicron variant, we have learned, may be less susceptible to the protection we get from vaccines. In other words, we are learning that the vaccines are likely to be less effective against infection with the Omicron variant. There have been 2 important studies in the last few days from the United Kingdom and Israel that have shown that people who received booster doses of the vaccine are better protected than people who only received the first vaccine several months ago. We also know that people who have had prior COVID-19 are getting Omicron infections more frequently than we would expect. We call this reinfections. And both of these pieces of information together combine to tell us that the defenses that we have built from either vaccines or from prior infections may not hold up against the Omicron variant very well, because again, it may have changed substantially and importantly in a way that lets it continue to infect more people. So when can you get a booster vaccine if, in fact, you want one and are eligible for one? Remember that if you had either the Pfizer or Moderna vaccines 6 months ago or longer, you are now eligible for a booster. And indeed, everyone in the United States, 18 years of age and older, are eligible for these vaccines. If you are 16 or 17 years of age and you have had your prior vaccines more than 6 months ago, you are now also eligible. If you previously received the Johnson & Johnson vaccine 2 months ago or longer, you are also eligible for a vaccine booster. And finishing up with just an important review of important COVID-19 tests that are available. Remember, there are molecular or PCR tests, which are sophisticated tests for nucleic acids, and these use very fancy big lab instruments generally. These are the type of tests that are usually done at a clinic or a hospital, and most take 24 hours to return. A different type of test, called the antigen test, is an easy-to-do test that doesn't need lab instruments, equipment, and can be done easily at home. These tests are looking for proteins, and they will usually be positive right before someone starts to feel sick with COVID or for several days after symptoms begin. And the current home antigen tests that are available to us all at drugstores, at grocery stores, are now being shown to work very, very well. It's important for us to remember that as with all tests, if your suspicion for COVID-19 is high because you have classic symptoms or you've been heavily exposed, please do talk to your doctor for advice, no matter what your tests show. Here are some examples of the currently available home antigen tests. And just to remind you, these are an excellent resource to just keep in your medicine cabinet at home. They're available easily over the counter and are a great option for when you are at home, perhaps with a slight change in symptoms, maybe those allergies are just acting up a little bit more than usual, or one of your children developing a tickle in the back of the throat. The antigen tests are a great resource. Again, I'll remind you that if your suspicion for COVID-19 is high because of your symptoms or because you've been exposed, please do isolate and talk to your doctor for advice, even if you have a negative antigen test. With that, I will finish and wish everyone a healthy and happy holiday season.